and welcome to today's segment of The Power of Money. I'm your host, Michelle Graves. For the last 36 years, as many of you already know, I have been known nationally and internationally as the Money Lady, and I do this show as my commitment to you, my viewers, to educate you on a variety of issues, specifically dealing with senior issues now, and to bring authorities and experts in so that you can hear their perspective and their information. Information is powerful, and the more you know, the better you can make those good, sound decisions for you and your family's well-being. So today, I have two very, very extraordinary guests to talk about one of my favorite subjects, which is seniors. And yes, I am a senior. Can you believe it? But it's happened to me. And that is Ray Copenheaver, who is a nationally recognized authority on long-term care issues, including long-term care insurance, as well as Jenni Blake, who is the co-owner of a in-home care facility in Dayton, Ohio, Dayton area, called Touching Hearts. So we're going to be talking about the power of staying in your own home, because I don't know anybody, and I may be wrong here, but I don't know anybody that wants to go into a skilled facility for chronic care if they can stay at home. Most people love their homes, and as they get older, they want to stay in their homes. And so today we're going to learn about how you can do that, and do that by engaging the services of trusted advisors. Before introducing them, I just want to say that I do post actively on Facebook, and I posted before the year was out, "Seniors, take care of your business." And I said that because all of this requires a commitment to planning and to handling your affairs in a mature and responsible way. Aging is going to happen to everybody if we live long enough. You're going to get there. Believe me, I didn't think it would come as quickly as it did for me, but I'm there. And that means responsible decisions. So today we're going to be talking about the whole issue of long-term care insurance and staying in your home. And I brought two of the best people that I know to talk about this very vital subject. So without further ado, let me introduce my two guests, and let me stop talking and let's start listening to them. Ray Copenheaver, how are you, my man?
I'm fine. Good morning,
Good
Michelle.
morning. And how are you, Jenni?
Good morning, Michelle.
Nice
Thank you so
to
much.
meet you both, and thank you both for giving me time to talk about. Personally, I think this is such an important issue. Would you like to share with people about your background this morning?
Well, just a little bit about our background. We, in the long-term care insurance field, feel we have a wonderful opportunity to serve American people. Specifically, we do most of our activity here in Ohio, and we're just blessed. We're blessed with the opportunity to serve folks as they move into their mature years, and we don't do that in a vacuum. We don't do that just within the insurance field. We interact locally and also beyond Dayton area with the area aging offices, the ombudsman's office, as well as the nursing home folks, assisted living, and nice folks like Jenni, who have the capabilities of serving folks in their home.
Powerful, powerful. And would you tell us a little bit about Touching Hearts?
Sure. Touching Hearts at Home, we're located in our main office in Lebanon, Ohio. We serve Butler, Warren, South Dayton, and Montgomery counties. One of the things that I think we pride ourselves in at best is reaching out to other people, such as Ray, to help families realize that there are options in aging. And as you mentioned, staying at home is what 4 out of 5 people do choose to do. And it's not always easy. It's not always easy to accept that help. And through Touching Hearts at Home, what we do is we align wonderful caregivers who bring an exceptional level of compassion, caring and dependability into the lives of seniors and also any adult. Through Touching Hearts at Home, we are able to serve anyone who is 18 years of age or older in an in-home care capacity. You had mentioned before the skilled care and different things like that. Through Touching Hearts at Home, we handle the non-medical side of it, the day-to-day living, things that help people stay active and healthy in their own home. Whether it's assisting with hygiene, medication reminders, meal preparation, companionship, and just being able to really continue to live an active, healthy lifestyle to the best of our ability, whether we're 18, 50, 65, or 90 and above. It really is about maintaining quality of life, and the best way to do that as we begin to age in particular is to have a little bit of help when family is not available.
Let's talk about that, Ray. Give me some feedback on what is happening and why are people in this situation today?
Well, I think 2 points. You were mentioning about Americans aging, and this is a blessing to not only Americans but worldwide. People now live longer than they did 20 years ago, and certainly we have a longer lifespan than we did in the previous century. With the long life, many times we are challenged with what Jenny was referring to as non-medical care. Care that we need to serve, and you say to finish our day's event, that does not involve a doctor, does not involve a nurse. It's the care that we might need with very personal items. Many folks like to call it long-term care. Some folks will refer to it as extended care. And even in the past, a lot of people would immediately call it nursing home type care. But I'd like to share, Michelle, with the folks today that in the United States, 85% of us who reach the point of needing that non-medical attention do not need to be going to a facility. We don't need that high level of care that a nursing home would provide.
Right.
But rather we need care with things like bathing and dressing.
Okay.
Very personal items. And that someone needs to help us with. Many times it's not necessarily hands-on care. It might be what they call standby care.
Right.
Okay, now what is standby care?
Standby care would be where maybe on certain days I feel better, I feel stronger, my condition today is not where I have a dizzy spell, but I'm more stable today. So then the folks that are providing my attention, they're just nearby.
Okay.
They're there to help guide me, and if necessary, use the hands-on technique.
Okay.
Possibly the next day, I'm not feeling as strong, I'm not feeling as alert, and now maybe the folks caring for me might actually have to help me put my garments on, help me with my bathing.
Dressing and things like that.
Yes, ma'am.
Do you also, as a part of what you do, which is in-home care,
Right.
beyond the dressing and you administer medications
Well,
sometimes?
we, as non-medical, we're not able to administer or dose the medications. However, typically a family member will, or maybe even a medical care agency, will dose out in the med minders the Monday through Friday, AM and PM. And, you know, even once that step is done through a family member, there are people who may wake up in the morning and they may not remember to take their medication. Or maybe their medication needs to be taken with food or water or at a particular time. Seniors or any adult really who is experiencing illness or chronic disability, if you wake up, as Ray mentions, one day and you're not feeling quite as well as you did the next, remembering to take that medication at the proper time, remembering to take it along with food or water as needed, may not happen. And what Ray mentions when he talks about that day-to-day and everything is different from time to time, we experience that with many of our clients. So having the opportunity, whether it's every day, having a morning caregiver come and help you get ready for the day, showering, meal reminders, medication, trips out and about, Or maybe it's just every once in a while I need to have a company, an agency available that I can pick up on the phone and call. If I'm not feeling well that day and I need a little bit of assistance, we're able to fill that need. I don't think you can speak enough to the importance of all of what we as healthy adults would consider normal parts of our day. Getting up safely, getting in and out of the shower without the fear, which sometimes it is just the fear for a senior who is unsteady to get in and shower. Maybe we'll miss that today because I have a little bit of fear, but maybe there's a little bit of a disability involved where there's trouble transferring from the floor into the shower and doing things like that. So in regards to the non-medical home care, you really can't speak enough to the importance of what we consider regular day-to-day activities being so vital in protecting our seniors in particular. Meals, shower, companionship, medication reminders. And I think because they are such basic tasks, a lot of attention is not given to it until family members or a loved one is in a crisis situation. And you know, being here and being a part of this program really gives an opportunity to awaken all of us to what we can do to protect our overall health and well-being, whether it is as a family caregiver or whether it is as an aging senior or an adult facing chronic illness. Lots of options.
Yes, but this is so important today because we all know the baby boomers, the Pepsi generation, 78 million, 10,000 coming out of the workplace a day for the next 20 years. That is serious. That is serious. So, Ray, who pays for this? Our government doesn't have any money. I mean, we're leveraged to the hilt. So who pays for the in-home care? Because people don't want to go into a skilled care, and they shouldn't, but what is a misnomer? People think that Medicare is going to pay for home care. Can you help me here?
Certainly can. We're talking about the problem of Americans aging, and we're talking about the possibility of needing care and attention that is non-medical. Many folks might think, well, I'm over 65,
Yes.
and therefore I have a program called Medicare. So with the government program of Medicare, I have coverage. I'd like you to hold that thought for a moment. Some other folks might feel that there's another program that they heard about, which is called Medicaid. So some folks might be under the impression that when I reach the point of needing this type of care, I'll have the government program of Medicare or the other program of Medicaid available. And then I'd like to put just a third ingredient there, and that is the people may also say, well, I'll rely on my family. So many times we're mistakenly operating under the fact that we have the family to rely on. If that doesn't work, we'll have Medicare, and if that doesn't work, we'll have Medicaid. Now, if you allow me, let's break down those three components.
Okay.
Let's begin with Medicare. Medicare, and I can speak to it with some experience because I'm over 65. Medicare is a wonderful program for those of us who are over 65. Medicare covers medical items. Medicare helps us with the hospital expenses and the physician expenses, and many times covers the majority of the cost. But Medicare is a medical model. It's not designed for me if I need help in managing my medications. It's not designed for someone to help me bathe and dress, to toilet, maybe even to feed me. It's a definite medical situation. Long-term care tends to be non-medical. Medicaid, again, another important program of our government, is available for those of us who reach a point where we need that type of care and we do not have the income or the resources to pay for the care. And then Medicare or Medicaid might reach in and help the family out, but we need to be in a very low income, and we need to be at the point where we don't have any reservoir of savings available.
Can you be more specific when you say low income and reservoir savings?
Well, the low income, Michelle, would be where, let's assume that my cost for my care is $200 per day, and I only have $40 per day of income available.
Okay.
So then I would be short that balance of 160, and if I don't have that in income, then I need to sell or liquidate what I have in the way of savings. Well, at the rate of 160 per day that I might be short, times 30 days in a month, that's close to $5,000 shortage. So then the individual is required to liquidate, or you might say sell, their savings. When they do that and they sell those savings down to a level of $1,500, $1,500, then Medicaid will be available to help out. A concern of that is typically Medicaid will not pay for the home care type services.
Right.
Typically Medicaid is going to require that I go into a facility.
Wow. So those are, and your third option with the family.
Family.
Because seniors say that a lot. Oh, my kids are going to take care of me. And I always find that a little bit interesting.
If we could go back a few years to when all of us were younger, it was more prevalent for the family to care for grandmother.
Yes, that's correct.
For the family to care for mom or dad, and to do that type of care until that person would pass on. And that still happens today, but not to the degree that it did in the past, because today Americans are more mobile. So many of us do not live in the same city that our parents or grandparents live. Many folks now are very deeply involved in their job, their vocation, and just cannot sacrifice and leave that responsibility because they have children possibly of their own. We all heard about that sandwich
sandwich
Oh,
generation,
yes. Oh, yes.
where I'm the person in the middle of the sandwich and I have my parents or grandparents that need my help, and I'm also raising children. So the beauty of what Jenny and I will share with you today relative to home care availability and what we call long-term care insurance, that can be the real solution
Absolutely.
to a huge problem.
My goodness. And when you say that, how does that work? And well, do you want to speak to that, Jen?
Sure.
Okay.
What I can speak to is that, Ray mentioned all of the other things that are in line outside of the private duty home care, which is
Okay.
basically what Touching Hearts at Home is able to provide. There are certain services available through different county resources. They are very minimal for most people. But what we do best is Touching Hearts at Home bridges the gap between all of the other services that are available to some and those that aren't, by providing service, whether it's 1 hour every once in a great while to 24/7. We are an amazing resource for families and for aging seniors to be able to say, I need some help today, maybe not tomorrow. We're a phone call away. I think that's one of the things that we pride ourselves in most is through Touching Hearts, a phone call can be made to us. We go out and meet with a family, discuss what we're able to do to help them in their situation. And from that point on, we're a phone call away, literally, to help with those day-to-day activities.
So how much does this cost?
Well,
Jenny?
it depends. It starts with an hourly rate of $20 per hour, and it goes up depending on the number of hours. Of course, some of our clients, we provide service to them on a live-in basis.
Oh my goodness,
Where
you
we go
actually
in at,
physically
yes,
live there.
ma'am. We'll go in one day at 8 o'clock in the morning and get off at 8 o'clock the next day, and we can cover that way. Or we can do 24 hours around the clock service with multiple caregivers, depending on the need of the client. Perhaps the most important thing when working with a home care company, or even you just having us here today to share our experience, is that there are experts in each part of the aging process. I don't know whether I consider myself an expert in
Well,
senior
you can
care.
say that. You are.
However, you know, I've been on all sides of the fence. I was that grandchild caring for grandparents many, many years ago.
You did have to do that.
Yes, yes. And that's where my start in home care came. I was in my early 30s and had to have care myself from a surgery that took a lengthy recovery.
Yes.
So there is no age, there's no limit to when we need help, and family can be busy. Even on their absolute best days, when we try to step in and help mom and dad, or help our grandparents, or help our aunt and uncles, there are times that the best system doesn't work and a backup plan is needed.
So,
and that's home care.
So let me ask you a question. And it's very important, because how do you get, we know what your hourly rates are, and that's totally fine with me, but we get back into, based upon what Ray said, Medicare will not pay for this.
Right.
Seniors want to be at home.
Absolutely.
Okay, and they should be at home, because there's no place like home, as Dorothy said on The Wizard of Oz. There's no place like home. But Medicare says, no, that's chronic care.
Right.
Medicaid says, you got to go into a skilled care facility and you have to be poor.
Right.
No money. And family says, we don't have a lot of money. So how do you get paid typically, from your own experience?
Our experience is that either our family members that we serve have long-term care insurance that provides the finances for that, or we may have some family members who say there is a group of 3 siblings. Mom and dad are not financially able to pay for home care themselves. They have a system in place where they each take a few shifts and they pay for home care as a collective group of siblings to help take care of mom and dad. I'll say there are 2 things that I feel keep people from accessing in-home care services, and that's fear and finances. Fear of having someone else come into your home and being able to provide those very personal services that Ray mentioned, and then figuring out how we're going to pay for it. So often families do not come to us in that stage where, okay, we're starting to notice mom and dad are having some difficulty in their home. What can we do to foresee any future, what I call tragedies, falls, extreme illnesses, long-term stays in a hospital or a rehab facility from something that may have been prevented by just making sure that adequate nutrition is received, that medication is taken on a timely basis, that the home is clean and safe. Finances keep so many families from reaching out to a home care agency until there has been some great tragedy, or until the family caregiver becomes ill and they're no longer available. So having this conversation about what can we do to set the ball rolling so that when the time comes that family is not available, when the time comes that there is illness or simply the aging process that requires some extra help, what can we do? And I think as an adult, I'm not to the point yet of having even my own long-term care insurance. However, I see the need and I'm prepared to take that step as my children age. It's an amazing gift that you can give your kids.
I think it is.
So many people, they think about, well, I'm putting away X amount of dollars for my loved ones when I pass. Having a plan where your family can work together, where you can be healthy and happy and active throughout your senior years is so important. And the vehicle to that is through long-term care insurance, because the other areas will not fill all the gaps that are needed.
Let's talk about that, Ray. Does long-term care insurance cover in-home care? Because the misnomer, I think, out here today is that long-term care insurance is strictly for skilled, formerly known as nursing homes. So can you bring us up to date with where your industry is as the expert?
Okay, the long-term care industry, and it's still maturing, but it has really blossomed now to the point where when we think about having an insurance plan, which means I have a policy that transfers the risk, transfers the responsibility onto an insurance company. The policies today will cover what we call comprehensive, and that would be the home care, or that would be an adult daycare that's available at times in a senior center or maybe a church setting. It will cover assisted living, which is still private apartment living, but getting some type of care with managing our medications or some other services. And then obviously the long-term care will also cover nursing home. So today we serve Americans with what we call a comprehensive plan. It's still called long-term care insurance, but it covers everything from nursing home down to home care. And to use some of the information that Jenny was sharing with us, it will cover attention that we need when we need it. So for example, maybe the family would say, if we could just get some alternate day care, if maybe we could have someone come in that we know and we like and that we trust, and they could come in maybe Monday, Wednesdays, and Fridays, they could help out the person needing the care. Then those of us in the family, we can rally around and do a plan where we can fill in the balance of the care.
Okay.
The advantage of this, Michelle, would be where the family can still provide a lot of the care and still maintain their responsibilities on the job or their responsibilities to their family.
Because that is a concern to me as I look at the amount of hours that now, I read some kind of a study recently which showed that caregivers literally are having to make decisions between going to work and taking care of their parents. And that many of them are women and are making the decision that I got to take care of the parent, but then the family suffers financially. And versus what you're talking about, where the policy would pay for the family to retain Touching Hearts by illustration, to come in and to do that work. Is that typically how that works?
That is how that works. Usually our phone rings and the other person on the other end is either a spouse who is completely exhausted. They've done everything that they can do to help their husband. You know, we'll just use that example. Oftentimes that family caregiver, whether it's a child, a friend, or a spouse, they often do not reach out until they're at that point of complete exhaustion. They'll give us a call. And, you know, there are many home care companies and many agencies out there available to assist families with caring for their loved ones. Or if you're that senior in particular who has taken the steps and made a plan, I know what I want. I know I want to stay at home. I know I want to be cared for. I know I'm not able to do it anymore. It's wonderful when we get that telephone call from that person calling for help for themselves. So to begin the process, if you will, I'll share a little bit of a backtrack about Touching Hearts at Home.
Okay.
Non-medical in-home care agency. We serve Butler, Warren, South Dayton, Montgomery, and Greene counties. Our office opened just October of last year, but Touching Hearts has been around for over 19 years, and we're steeped in a tradition of service to others and being able to fit that right caregiver with the right client, where we match their social, emotional, and physical needs. And Ray mentioning the aspect of care where maybe it's not around-the-clock care, maybe it's not maybe it's filling the gaps where loved ones need help. We get the telephone call. We're usually able to answer quite a few questions over the telephone, but nothing makes someone feel better than that face-to-face introduction.
Right, absolutely.
And one of the things another thing that we pride ourselves in, my business partner Kelly George and I, we meet with every single family. We sit down, we talk with them, we discuss what their needs are. Oftentimes, through a casual conversation, we can uncover some ways that we can help that they may not have even considered. And it begins with the phone call, a no cost, no obligation consultation in the location of choice for the person calling. And nothing makes the process easier than sitting across from someone, getting face-to-face answers, and feeling that ease where fear once was involved with having someone in your home. And the pages are turning in that it's no longer just crisis care or crisis management. By accessing services through long-term care, you are really able to map out what your wishes are, how you would like to be cared for. If I could get any message to anyone, whether they call Touching Hearts at Home or any other agency, get out, get involved, find out what's available to you, and form that relationship with a home care company before the crisis evolves. If you can build that steady relationship with an agency such as ours and caregivers and family members, the transition to some of those personal care needs that we talked about frequently today is unbelievable. And that's where home care makes a difference. We make a difference in how do you feel today? Are you clean? Are you healthy? Are you a senior who is just sitting there every day with no family that visits, or maybe family that visits? Maybe you need a little bit more help, but you don't want to pick up that telephone and ask your daughter Jill to come one more time. We are able to really map out a very good aging process with the families that we serve. Quality of life is key. As a female in particular, I feel better when I'm up and I'm showered and I'm dressed. But if I'm not able to do that by myself, whether it's I'm not able to get in and out of the shower safely, maybe I don't, you know, if you're using a walker or a wheelchair, logistics are an issue. We are able to do all of that and to keep people healthy and happy and safe in their own home.
Now, interestingly enough, you get the opportunity to see through her agency how long-term care insurance plays out. How difficult is it to get this insurance? I mean, we can start off 214 by saying that rate increases, qualifications, underwriting, a lot of people are scared. They know they have the need. And I think that while history may say crisis planning, I think that the media has pretty much put the case before the people now, which is this is here, the silver tsunami and all of that. So can you talk to me about that, Ray?
Sure. Suppose this booklet that I have here represented my insurance policy.
Okay.
And it was called long-term care insurance. And by the way, this is what they call the, this is the shopper's guide to long-term care insurance.
Put that up.
And folks, this would be available by just calling Michelle at her number that you'll see later on, and that could be made available to help explain what the insurance plan is. But let's suppose that that is my policy. If I have a policy, then as Jenny was mentioning about the need for planning for the future, having that policy means that I have done some planning. I have considered that in my later years, I may not be able to totally take care of myself as I am today, and therefore I have a policy ready to pay out benefits that might allow me to stay in home. Now, the policy is much like any other type of insurance. We pay a premium to the insurance company, and you mentioned premiums, you mentioned some rate increases. The policies today have a cost that is higher than we would have thought about 10 years ago. But let's take a typical person who buys a policy. The average age in Ohio is 58.
My goodness, 58 years old.
58 is the average age.
You would think it would be older.
Well, and it was older, Michelle, years ago, but when we say the average age is 58, that means that some younger folks at age 45 are locking in their plan, and also some folks at age 70 or 75 are locking in their plan.
Okay.
Now, you ask, how difficult is it to obtain the plan?
Right.
Well, first, the plan would cover care for a facility, or it would cover care in the home. So the individual would know, and their family would know, that there's been some planning done. and that the policy is there ready to pay out benefits if it's needed. So let's take that person age 58, and let's assume that they wanted to have a good solid long-term care plan that would give enough benefits to stay at home.
Okay.
Enough benefits, and let's just use an average of $150 per day up to maybe $200 per day benefits available. Then, Michelle, the premium cost for that person at age 58 would be somewhere in the area of $200 per month premium cost.
Okay.
So I'm age 58 and I'm going to pay $200 per month to the insurance company to have that protection. And that policy sits there and protects my assets. And I mean more than savings when I say assets. It protects also my asset called independence. So I
That's
can
good.
stay
Absolutely.
home.
Independent.
But let me go back to the
Okay.
$200 per month. So I'm going to pay that $200 per month, which times 12 months is about $2,400 per year. It is possible as I age and the years pass by, the insurance could have a rate increase. So I should think about part of my planning, should think about the plan being $2,400 per year, but maybe later on it might be $3,000 per year. It might even go slightly higher. So I need to have that in my planning thoughts. Now here's the wonderful thing about long-term care insurance. When that need reaches the point where I call Jenny
Okay.
or I call Kelly and I say, we need some help here in our house, then the insurance is ready to blossom into benefits. And Michelle, we no longer pay premiums.
You no longer pay premiums.
No, the policy is what we call guaranteed to be available for us when we need it. And then when we need it, the insurance company says, don't send us any more premiums.
Oh my goodness.
We will now send you checks to pay for the services.
For your
Right.
care.
So it's a wonderful solution that it's my responsibility, and people such as you who are doing these communications, Michelle, is to let Americans know that yes, the premium might be considered rather high for the protection. But when I need that protection, then the insurance
there.
company says, now we will begin to pay services.
Well, if I might be rather direct, I believe that the premium quote you gave is much cheaper than the cost of the care.
I'm glad you said
Absolutely.
that $200 per month, which again, I don't pay once I need the services.
Right.
Let's assume that at age 58, I pay that $200 per month, and let's say that I pay that for 20 years. I'm going to be paying into that insurance company maybe somewhere in the area of $40,000 of premiums.
Okay, aggregate.
Aggregate
Okay,
for
okay,
all those
okay.
years. However, just 1 year of care today is in excess of $50,000
Absolutely.
per year.
I was going
Okay.
to add, as you and Ray were sharing about that monthly premium cost, if it's $200, just a heads up to some of the viewers. Not that all people require a 24-hour-a-day in-home care provider. The least expensive method or mode of that 24 hours of care will run roughly $250 to $270 per day based on which agency you are having in your home. Now, that is on a live-in caregiver. That's
Okay.
one caregiver, one day, who is able to be there for a 24-hour period, but that caregiver needs to be able to sleep. Now, if you become in a situation in which you need to have around-the-clock care, 3 caregivers a day, you're talking roughly $18 to $20 per hour times your 24-hour shift.
Yes.
The value of long-term care insurance is unbelievable. And I think because so many people have yet to experience that daily cost or that extreme need for care and not plan, you really can't fathom it unless you have worked it seen it and been a part of it and know just exactly what it costs to stay at home when you become in a level of need. And you know, having said that, so many of the people that we care for that access their long-term care policy, they don't need that 24/7 coverage.
Right.
Many of them have a 2 to 3 hour window in the mornings for, you know, assistance getting up, getting ready, getting their day started. Maybe we'll go back for 2 hours for dinner, or
Okay.
maybe 4 hours to help them get into bed. We talk to getting the word out that care will be needed. It's not, it is not if, it is when. And, you know, you'll either be on the side of the fence of that working man or woman trying to balance career, family, helping a sick or aging loved one, or regardless of your age as an adult, you could be on that side of the fence of needing care. Long-term care really should not be considered an option, but a necessity for just about everyone, especially those over the age of 45. If you take into consideration that one day of around-the-clock care will cost
My goodness.
more than an average monthly policy premium, it's a no-brainer. It really is.
Another interesting aspect when we talk about the cost of care,
Yes.
when the care impact reaches the family level, many times it's sudden. Yesterday, Dad or yesterday, Grandpa was independent, was playing golf, was going to work. And today, it's different. Something happened, a fall, as Jenny mentioned, or some serious illness that the person didn't totally recover from due to the surgery not achieving all the results. However, the person is still alive and still needs care. This policy starts out with helping to pay for that plan of care. So Jenny was talking about how they will help evaluate the needs of the person, and they will help determine what would be a good plan of care. Well, there's a cost associated with that service, and long-term care insurance pays for that type of the care development.
Really? That's
And
nice.
Another thing I'd like to mention, there's a booklet available if an individual would go online to www.longtermcare.gov called Ohio Own Your Future. And it summarizes a lot of the information that we are covering here today. This is available not only in Ohio but other states. But for those of us here today, just go to that national website, www.longtermcare.gov, and print out that manual. And it will help guide, and it'll kind of, you might say, verify and help substantiate what we're talking about today.
I think, too, one of the important parts of the puzzle is that we're so fortunate to even be having this conversation and to be
Aren't
able to
we?
share it with
Yes.
other people, because what we really want to move away from in the aging process and in this industry that we are all a part of, we want to move away from that act of crisis to an act of planning. Just knowing the options that you have available through your long-term care insurance, contacting, say you're someone who may not have the means right now to pay for excess services from an agency like Touching Hearts at Home. One of the things that we have done is we've aligned ourselves with all of the other industry caregiving agencies, all the other resources. We look for ways to help serve our clients and those who reach out to us, whether or not we end up being the actual caregiving agency. There's a lot that's available. We have so many options. The problem is, A, we don't think about it until we have to. B, we can't afford it. And then C, when we're talking about having long-term care or a caregiver outside of someone that you feel very close to, that you know and you love and respect and feel comfortable and confident providing care service to you, that's a very difficult thing for many people to even contemplate. Through an agency like Touching Hearts at Home, one of the things that we do is we provide peace of mind to that person receiving the care. We take every step possible to ensure that we have found a great caregiver who is compassionate, caring, realizes that the job that we do is so much more than just a job. We are helping someone maintain a healthy, happy quality of life, not just averting tragedy, not just being a part of the crisis. When we are a part of that crisis situation, it is a wonderful thing that we can do to help families cope with whatever it is that's going on. If mom or dad has fallen, suddenly there's a broken hip and they can't get along in the house okay. If there is an illness, or maybe they're beginning to notice the onset of some dementia related issues, and having someone like Touching Hearts at Home involved can really change the path of end of life. It really can. It makes a wonderful difference for families to know that, you know, hopefully they have talked to someone like Ray and they have put steps in order to be able to afford in-home care. Just knowing that if you are that person providing care, if you're sick, you have a telephone number to call. You don't have to wait till next week. You could have a doctor's appointment scheduled for tomorrow afternoon, and maybe you are planning on taking care of whatever it is that you need to do. Something happens and you're not able to be with mom and dad. Having a caregiving agency like Touching Hearts at Home is a wonderful backup plan for those who need a backup plan, but it is a wonderful plan just for having quality of life, maintaining healthy, active, healthy lifestyle. And really, for most of our population, the only way to do that is through long-term care. Most of the general public does not have the ability to call upon a home care company when it is not a matter of crisis. So just knowing the options, knowing that for the cost of one day of care, you can cover a significant amount of time and set a significant safeguard for both yourself as the person who would be receiving the care, just the same as for your children or your neighbor or your friend who may be the one stepping in to help you.
Let's talk about Alzheimer, dementia, memory care, and how that looks in a home environment, because statistics are startling.
Absolutely.
As to the number of people that have Alzheimer or are heading in that direction, epidemic.
Right. You know,
how does that work in home?
How that works in home, I can tell you that from our personal experience with Touching Hearts at Home, one of the things that we are able to do is we notice those subtle changes that may be taking place, where perhaps the person that you were with yesterday doesn't remember if it was you or Joni who was there the previous day. Maybe
so they're going in, you're going in for a different set of conditions.
We may be the first people to kind of, through some of our note-taking and record-keeping that we do, notice some very subtle changes with someone who may be experiencing onset of Alzheimer's or dementia, or maybe it's just a product of not having taken their medication. But if you will, of the Alzheimer's, it really depends on what level or what stage that the individual is at. Many people in the beginning stages of Alzheimer's or dementia, they can live alone and they can be safe and they can be healthy and active. But having someone there to see that the steps are followed through, to establish a routine, to maintain safety and cleanliness of the house, different things like that. That might be someone that needs 2 hours of care every morning and maybe 2 hours of care in the evening. That very same person or someone else may need someone to be with them around the clock because they are at risk for wandering. But we also are there at the very end stages of life, whether it is our home care company in and of itself or a hospice agency is involved. With Alzheimer's, dementia, Parkinson's, so many of those dementia-related diseases or the disease process, it just depends on what stage you're at. The stage, the support that you have from family or loved ones or other volunteer caregivers or agencies, all of that will play a part in what what we would fill the gap for. Do you know what I'm saying?
Yes,
as
I do.
far
I
as
do.
that. So there are so many varying degrees, so many varying levels of dementia-related illnesses. We really can be there, like I said, around the clock, or we can be there on an as-needed basis, or, you know, every day, 4 hours a day when a family member is not able to be there. Talking about dementia-related clients, it is so important that you find an agency, whether it's Touching Hearts at Home or someone else, who is very involved in the education process,
Right.
training. I'm a certified dementia practitioner. Our caregivers complete a program through Acquire Training that is a dementia care specialist.
Okay.
When you're working with someone with Alzheimer's or dementia, it is very different from working with someone who is, you know, experiencing other illness or other stages of disease. It requires someone to be very patient, very, I would say, routine for certain, an amazing connection with someone. Oftentimes, especially with the beginning stages of Alzheimer's, that level of trust, that level of relaxation that you're able to provide that client will set the pace for the rest of the day. So when you're talking about Alzheimer or dementia-specific care, it is very important that you reach out to an agency for services that is well steeped in the traditions of the Alzheimer's Association, that is knowledgeable of all of the resources, that provides a training program for caregivers geared specifically to that clientele. Having said that, you know, we're a home care company. We work with many different people. When we send a caregiver into a home, Kelly or I do the introduction, we may work hand in hand with that caregiver a couple of shifts a week. Maybe it'll be a short introduction. We consider every person that we serve different regardless of their illness, their disease, or the aging process. Just because you have one client with dementia does not mean that a caregiver with experience with Joan is going to work well with Bill, because they're different people.
Well, I tell you, I have had last year, I had 2 situations where I was asked to relieve caregivers whose parents had Alzheimer. And I will tell you, I'm an incredibly patient person. But I found myself ready to, in one situation, like flee
Absolutely.
for my sanity. It just was.
It can be challenging.
Yeah, I think you do need to have specific training.
Absolutely.
For that type of illness.
Communication is key, whether that's between, you know, Kelly and I as the owners and the case managers of our families, or it's the caregivers going in the home. When you communicate between your staff, between the family members, and you have a very active role as a case manager, as Kelly and I participate in, you will find that you're able to overcome a lot of obstacles. We keep in great touch with each other. If we have a caregiver that had a difficult day with the client, we may have a group meeting or phone call or conversation and say, okay, this happened to us today. Have you experienced this, and what did you find work for helping that? You know,
I'd like to, because believe it or not,
is our hour almost up?
I'm so serious. As we speak,
Yes.
I would like for you to give your telephone number, would you please?
I will. We can be reached at 937-558-9394.
Can you say that again?
Yes. Touching Hearts at Home can be reached at 937-558-9394. We answer our phone 24/7, and we're always available for families in need.
Now, do you cross down to Southern Ohio and Kentucky?
Yes. Actually, the furthest south that we are as of right now is about Sharonville.
Yes, I know exactly where that is.
We do have an opportunity to serve a little bit further south. Butler, Warren, South Dayton, Montgomery, Greene County, parts of Hamilton.
Okay.
Now, having said that, if a family was to reach out to us in
Right.
need of care services and we were not able to provide them due to the location, we would be on the phone
Getting
trying
someone
to
else,
help
an
find
affiliate.
resources to fill the
Okay.
need for them.
Because the show does go as deep as into Kentucky.
Absolutely.
So I wanted to know. And Ray, long-term care insurance has a home health care component.
Yes, it does.
And once they go on claim, they don't have to pay premiums.
That's true. I think it would be good to summarize on the insurance part.
Okay.
That the insurance is, the benefits are triggered by one of two things, either a physical impairment or a cognitive impairment, which could be some form of dementia
Okay.
or Alzheimer's. And when either one of those triggers develops, then the plan is available to pay out benefits. And one component that we didn't talk about that I think we should summarize here would be
Okay.
that today the insurance plans that we help folks with in Ohio are what we call Ohio partnership plans.
Yes.
So in addition to the insurance plan protecting our assets, which we call our independence, in addition to that, the long-term care plans today, which would be an Ohio partnership plan, will also protect our financial assets. So whatever amount of protection and benefits are paid out by the insurance policy, each dollar for dollar, we have also then protected that level of assets of our savings, so that should we later in our life need to claim Medicaid help,
Yes.
to get Medicaid help, then we can actually draw the Ohio Medicaid benefit and still keep dollar for dollar our assets. So that's a powerful formula
Powerful.
of the plans today.
Give us your number, and I see some books over here. I want to, because we're running out of time, and I want people to know. Are these books that they can communicate to get?
These are booklets that I would suggest that they would contact
Okay.
you or us, Michelle.
Okay,
And
here
most
they
of them
are.
are written by Kiplingers, and
Yes,
there's no
here's
charge
one.
for us to make that material available. And if you call in to our local office,
Okay, give us that number.
937-294-1415. I'll say that again.
Okay, thank you.
It's a Dayton number, 937-294-1415. We would be glad to make sure that that would be passed on. And at that time, we would also send along the shopper's guide to
That's
long-term care
excellent too.
insurance.
Yes.
And probably provide a summary information on the partnership plan as well.
This has been, viewers, has that not been powerful? At some point in your life, if you live long enough, you're going to be facing these kinds of decisions. You and your family. You should begin to have these conversations now. If you are children and you know for a fact that you are not going to be able to make those financial commitments, then you should consider paying the premiums for long-term care insurance for your parents. It's a good financial investment for you. Just sharing these things because times are changing and they're changing fast. And we're never going back to the way things were in the past. So I want to thank you as always for participating in this conversation about being in the home, using long-term care, and using an in-home care agency such as Touching Hearts, which is a remarkable company. And in closing, as I say every show, God bless you and you have an amazing day. See you next time.